Welcome you all to this dedicated educational channel of ENT and head neck surgery. I am Dr. Gaurav Datta, consultant ENT and head and neck surgeon. In this video, we will discuss about the advanced management of epistaxis, which is mainly done by ENT surgeon, but all the steps should be known by each and every medical staff. In part 1, we have seen the first aid and the immediate steps which have to be taken by each and every person who is facing the situation of epistaxis. But if there is profuse nasal bleeding, even after the first aid taken by the person for more than 20 minutes, then it's high time that the one has to go for the advanced management. If you want to check the first aid measures which have to be taken, I am sharing the link of the part 1 of the epistaxis in the comment section. So if there is a profuse nasal bleed for more than 20 minutes, it's high time to shift the patient urgently to the nearest hospital where we follow this given protocol. Now I'll explain you the step-by-step approach of the management of the epistaxis. In step 1, we'll do the general assessment and the resuscitation of the patient. If the patient is cardiopulmonary unstable and is having difficult airway, then we'll immediately rush the patient and give cardiopulmonary resuscitation to the patient. But if the patient is hemodynamically stable, then we'll move forward towards the process of the assessment of the patient. In step 1, we'll protect the airway by keeping the patient sit up and forwards and clearing all the collected blood. Then we'll obtain IV access and send the routine blood reports. Consider for fluid resuscitation initially with IV saline. If the patient's hemoglobin is less than 7 gram per deciliter, then we have to do blood transfusion based on the symptoms and the history of ischemic heart disease. If the patient comes with a nasal pack and the bleeding is controlled, then we'll directly proceed to packed epistaxis, about which we will talk in later section. If there is a torrential nasal bleed, then we have to remove the pack and examine the nose. In step 2, we will prepare the nose for the examination by applying adrenaline chloride solution or xylometazoline hydrochloride nasal drops, which are the topical vasoconstrictor. Bleeding should be controlled by anterior compression and should be discontinued if it leads to post-nasal bleed. Clear the blood by suction, nasal blowing, forceps or irrigation. Bleeding site must be established and documented by anterior rhinoscopy or rigid nasal endoscopy. This is anterior rhinoscopic examination using a 30 nasal speculum. But nowadays we do rigid nasal endoscopy, which gives a better picture of the site of the bleeding. This is the video showing the nasal endoscopic examination using a rigid nasal telescope. In this, we can find out if there is any bleeding points or not. In this patient, there is a sharp septal spur towards the left side, as you can see in the video, which may be the cause of a bleeding. If the bleeding site is not seen on endoscopic examination, then it is called as abated epistaxis. The patient has to be observed for 24 hours followed by discharging the patient. But if on endoscopic examination the bleeding site is identified, then we'll move forward to step 3, that is the direct therapy, where we will do electrocautery or diathermy to the bleeding site, or we can also do 75% silver nitrate chemical cauterization around the bleeding site. In this video, we can see the chemical cauterization which is done with the silver nitrate. The bleeding site is identified and the silver nitrate solution is applied around the bleeding site. This does the coagulative necrosis around the bleeding site and stops the bleeding. In this video, electrodiathermy is used to stop the bleeding by application of the diathermy over the bleeding site. Both chemical and electrodiathermy can be used for even posterior epistaxis also after the site identification is done. After the bleeding is stopped, we will move to step 4 where the nasal packing is done. Anterior nasal pack is done using non-absorbable Merosil, as you can see in this picture. And in the case of posterior epistaxis, Foley's catheter is inserted. In high risk cases, anti-staphylococcal antibiotics have to be given. In balloon packs, inflation has to be rechecked after 30 minutes or in case of further bleeding. In extreme cases of epistaxis where there is vascular injury, we have to move to step 5, that is the vascular intervention. To know about the blood supply of the nose, you can check the part 1 of epistaxis given in the link below. We have to arrange for examination under anesthesia with sphenopalatine artery and or anterethmoid artery ligation Embolization has to be performed where the ligation fails or is impossible. This is just a revision of the vascular supply of nose, where the major arteries are the anterior ethmoid artery, greater palatine artery, sphenopalatine artery, and the superior labial artery, which forms the Kiesselbach's plexus or Little's area at the anterior-inferior part of the nasal septum. This plexus is the most common cause of the anterior epistaxis. Usually the ligation of the external carotid artery is sufficient to stop the bleeding, but in some rare cases, the common carotid artery has also to be ligated. This is a picture showing the radioembolization of the great vessels after performing the digital subtraction angiography. An angioembolization agent is injected in the great vessel which forms a vascular supply to the nose. Embolization is considered to be the last step in management of the epistaxis. Once the epistaxis is treated, we have to observe the patient for 4 to 24 hours, and if everything is normal, then we can discharge the patient. If the patient is chronic hypertensive, then antihypertensive has to be added. All the blood thinners must be stopped immediately. Liquid paraffin nasal drops have to be prescribed so that if there is any nasal crusting, it can be removed smoothly without any refractory epistaxis. So with this video, I think it is very helpful to all the medical staff, especially the ENT surgeons, to manage the epistaxis. For any ENT related queries, you can contact me and call me on this WhatsApp number, or you can contact me on this YouTube, Instagram or email ID. Please do like, share and subscribe to my YouTube channel. Thank you.